Hi, everybody. My name
Hello.
is, hi. Thank you for showing up. Um, Congratulations on making it this far into your spring into summer challenge. And hopefully you guys are getting some results. My name is Grace Tang, and I am the owner of Strive Physical Therapy and Fitness here in Morrisville. So we are a sports and orthopedic physical therapy clinic, and we treat a vast array of injuries, including overuse and sports injuries. So I hope you guys are doing well. I've spent 19 years treating sports and orthopedic, neurologic, and chronic pain conditions. So hopefully you can use me as a resource, and you can also email me afterwards if you have any questions. Um, so I just apologize a little ahead of time because this is my first time conducting like a Zoom session, and since I really kind of staring at myself, so but I apologize for any awkwardness, but I hope that I can give you some insight and get the message across. So I've been asked to talk about recovering after, how to recover best after your workouts. And that really depends, right, on whether you're doing a strength workout or cardio workout. Um, so, in terms of you are 6 weeks into your challenges, and you want to make sure that you are able to hit all your workout goals without injuries. So, of course, after your daily workouts, the most important things are hydration, the appropriate nutrition, um, and because you work your muscles, so you want to make sure your muscles have the right building blocks to build back. Um, and cold therapy to decrease the inflammation in your muscles and joints. Either that or some kind of bath, Epsom salt therapy. And also the most important thing for me really is the muscle recovery. So you would um, to improve the sore muscles, to decrease the lactic acid buildup in your musculature, and if you have any specific joint issues like tendonitis. So you would work on every time you work out, whether it was a cardio workout or a strength workout, then you would work on specific areas with the foam rolling or cupping or massage, what have you. So those things make it really possible for people to treat themselves as opposed to coming to having to come to the physical therapist or massage therapist each time. You can work out a lot of kinks and spinal issues with a foam roll. If you wanted to know certain specific techniques, I can also review that at the end of this video, this presentation today. Is there anything that you want to know specifically about muscle recovery or joint recovery? So for example, we always advocate use of foam rolls because it really helps to improve your fascia, your fascial mobility and your muscle mobility. So as you develop restrictions because of overuse, you can loosen up your tissues with foam rolls and cupping and various tools. So that will prevent you from having to go to a medical professional. But as a PT, the thing that I address a lot is actually, for example, tennis elbow and golfer's elbow, really from weightlifting, TRX, any kind of excessive pulling motions. And so as you place excessive tension on your tendons of your elbows, you can have micro tears, and that is a repetitive strain injury. So as you're constantly gripping and you're injuring your tissues, it changes the tissue structure over time, where you're not able to withstand the tension forces anymore. So you get micro tears. It becomes inflamed, and when it's chronic, it's no longer inflamed. The tendons actually become more stiff. And so as a PT, we do a lot of soft tissue massage. We do dry needling to work out the muscle trigger points to loosen them up. And we do specific loading of each target muscle in order to improve the tension capacity of that muscle, and also to improve the soft tissue mobility. And the same goes for example, Achilles tendonitis. It's kind of similar in that the tendon becomes stiff. It can no longer withstand the tension forces of when you run, when you stop and pivot, when you jump. So as the tissues become stiffer and stiffer, you start to have you can have micro tears of the tendon, and you can have irritation where the tendon attaches to the bone, a lot of inflammation there. So as a PT, I work to improve the soft tissue mobility of those tendons and the muscles. And we also look at specific biomechanical issues of the feet, maybe the arch positioning, or the foot support isn't appropriate for the activity that you're doing. And so we can analyze those issues and help you to have better forces coming in through your feet to your spine, your hips and your spine, and therefore less injuries, less repetitive injuries to your Achilles tendons and your patellar tendons and your hips and your spine. So I guess the challenge for me with this topic, recovering after workouts, is that there's actually so many things to talk about. And I guess from a physical therapist point of view, there's a lot of, I want to talk about specific joints and joints and muscles. And so it's kind of I feel a little bit less focused when I'm doing this talk, because I'm not going to talk about the nutrition part of it, because that is not my realm. That's not my scope of expertise. And really what I can talk about is what I know best, which is joint injuries and muscle injuries, and maybe posture correction. So I want to tailor it to the needs of the audience here. Do you have any specific questions regarding your injuries or your workouts? No?
I know that I actually played college soccer for a while. And played it my whole life. So of course, like, I have lingering pain from that, even when I'm working out today, particularly in the knee area, all over the front, sometimes in those tendons in the back. Do you have any suggestions for alleviating that kind of pain? Because I know that that's a difficult area. We've done a foam rolling clinic as part of this challenge, but I couldn't really find any relief using that technique.
The tendons in the back of the knee?
Yes.
So hamstring tendons.
Yes.
I mean, that's common. So in the back of the knee, you have the calf muscles that come up. The gastrocs actually cross the knee. So it could be discomfort of the gastroc muscles with trigger points, or it could be the hamstring tendons that go down then cross the knee. Foam rolling in that area is a little tricky because you have to really support your whole weight onto the foam roll. I mean, you will cross your leg so that you can get each specific tendon on the foam roll, and you can roll yourself, but not a lot of people can hold their weight up in that way. So, so soft tissue massage is probably the best thing to do for that. And actually, the body balls, the body work balls that are more denser would be a one way to get it. Sometimes I ask patients to roll on a basketball because the basketball is nice and big and they can just put their knee on it. But really, the besides massaging yourself, the best thing to do is to go to a massage therapist or the PT, because then they can really get in there and work out the tendons and improve the soft tissue mobility of the tendons. And you would do as from a PT standpoint, I would have to figure out why those tendons are excessively active or sore. And a lot of times it has to do with weakness, like in the upper hamstrings, weakness in the gastrocs, or maybe weakness of your core muscles. So that would have to be figured out. But in terms of specifically as a soccer player, I will have to look at the running mechanics, and if there's any issues with the ankle mobility, so that biomechanically there might be some nuances that are increasing the activity of the knee flexion of the hamstrings. But probably that's an area that you can work out yourself. Although I really like Graston technique, which is with metal tools, and I can kind of really scrape out the whole area, including the tendon sheath and the entire hamstring muscle. So it's not an issue just at the hamstring. It's the entire hamstring complex that might be an issue. But yeah, so specifically as a soccer player, I would work on eccentric hamstring strengthening, which is loading the hamstring while it lengthens. That's probably a deficit that you have that's making the lower hamstrings work harder. So you work on upper hamstring strengthening in order to improve the mechanics of your running, which will decrease the activity of decrease the strain on the lower hamstrings and the tendons. Hope that answers your question.
Yes, that does. Thank you for that information.
Yeah. And with soccer, specifically soccer, it's because you're planted on one foot and you're kicking with the other. So really the planting foot, including the glutes, the hip muscles have to be very stable in order to allow for the other leg to swing. So I'll have to look at the opposite side of where you're having issues in order to find out where the imbalance is. Yeah, but that's definitely an area you can kind of work out yourself.
Yeah, I think I have those body works, they look like lacrosse balls. I have some of those at home. And I will certainly look into the Graston that you mentioned. That sounds like that would be great.
Yeah. I will I'll show you one tool that I'll use on the hamstrings. As there's no one here now, so I can walk around the clinic. I was stuck in the room before. All right, excuse me for that. But so this is like one of the Graston tools. Okay.
Oh, wow.
And so I use just use in this fashion. And so I would work on the whole thigh, and I can
Mhm.
use these sharper nubby parts to get into the hamstring tendons. So if you had tendonitis, which is really inflammation of the tendon sheath, the protective sheath around the tendon, I can actually work out the adhesions in the tissue with a tool like this. And it's a
Wow.
bit aggressive, and it depends on how much the patient can handle and how acute the injury is. If it's chronic, I can use a good amount of pressure. And then, so it's a set of tools, and this is another one that's probably the most well-known one. Is, patients call it the butter knife. So we can use this to, for example, to work on like tennis elbow and work and just
Oh,
the adhesions in the tendons where it attaches to the bone, the lateral epicondyle. So, and the goal for these kind of tools is to create a bit of a micro trauma in an area that's already irritated. But by creating micro trauma, then you can kick in your body's natural healing processes. So, for example, like fibroblasts are the precursors to your connective tissue. And by irritating the tissues, you actually get a rush of fibroblasts to the area. And so the fibroblasts they just get laid down as new connective tissue. And so the goal with chronic injuries, especially like Achilles tendonitis or patellar tendonitis or the tennis elbow, is to kind of graded irritation of the area in order for your body to kick up the healing process, especially when it's no longer healing and you've had it for a while. So as a PT, I use these kind of tools quite a bit. We are a manual therapy practice, so there's most of our patients are getting hands-on work. But yeah, those are some fun things to show you. Does anybody else have any other issues that they want to ask about?
I did, much like Rachel is a soccer player. I find myself sitting at my desk a lot all day, and I was kind of interested in what I could do to really like work on my posture and just keep myself stretched out.
Yeah. Well, so we're mobile beings, right? We're animals. Like, we're mobile animals, really. And to be sitting at a desk all day, or even standing at a desk all day in one position, is not ideal. So we definitely become, our postures change and adapt. The first thing I noticed when I started working in Morrisville, this RTP area, is I said to myself, my patients are slowly changing into the position of a chair, right? So they're rounded, their hamstrings are tight, their ankles are tight, and their shoulders are tight. So the best thing is to avoid sitting for a long time. The Mayo Clinic calls it a sitting disease because it leads to diabetes and high blood pressure and weight gain and yada yada, and therefore early death. So you want to avoid sitting for a long time. Every 30 minutes, get up. If you can have a standing station, just to sit upright, then your posture will change. It's just much easier to stand upright if you're standing, to be upright when you're standing. But you can, besides neck stretches and chest stretches, I ask all my patients if they can to get on a foam roll. And I can show you some foam roll specific exercises. Okay. If that's all right. Okay, that's better. All right, so you lie on a foam roll like this. And of course, you can stretch out like this. So you're stretching your pecs. And so you can stay there, about 30 seconds to a minute. Just don't let your fingers tingle if you got some other issues. And I call them foam roll angels, where you can bring it down, you bring it up. So you're slowly stretching your pecs, and just make sure that you don't have shoulder pain at the top. So I'm not bringing it all the way up. You're just trying to stretch your pecs. So you're here, I'm a little tight, so my hands are hovering a little bit over the floor. You're here, so these are called foam roll angels. And you can also do what we call goal post, like in football. Here, you're gonna grab your elbows together, and you can go over the roll like this, and then bring it back. So it looks like I'm doing a sit-up, and I'm actually mobilizing my thoracic spine. So after a day of sitting, this would be good to do to correct the stiffness in your spine. You're here, you can bring it back. So you will go down the vertebral levels up to about your nipple line. So you can mobilize your own thoracic spine in that way. If you had an exercise ball, you would just open your chest up over the exercise ball. But anything to improve your pec length and get your shoulders back would be great. And a lot of our clients are working on getting posture supports, posture bras, things like that to help them, to remind them to bring their shoulders back. So you can also purchase some brassieres that have more support. They're made for posture support. So on the back, it would be like a crisscross so that you have a little more support. But the main thing is you want to move throughout the day, because we weren't meant to be sitting at a computer all day. So ultimately, we're going to, all of us, including myself, are going to develop posture habits. And so when you're sitting at a desk all day like this, and then you go to swim, then you're going to create impingement in that shoulder, because your shoulders have been rounded and your thoracic spine is rounded. And so as you swim, you're going to have issues with your shoulder, you're going to have issues with your neck. So there's a lot of implications here where the best posture will prevent you from having injuries, especially in the shoulders and the neck, and it's with overhead weightlifting as well. I hope that was helpful.
So much. Yeah, thank you.
Everybody should have a foam roll. And if you can't do the foam roll exercises on the floor, you would take it on against the wall. And you can also do these stretches like against the wall. And so you have,
oh yeah, I like that option.
Yeah, and so people, some of our patients, can't get it down on the floor. So we show them that way. And you can also, lean against the wall, against the wall. That's
I feel like that would be more doable in my office, but I do think that would be a great and pretty quick, easy way to take a little break.
Yeah, and somebody like
chair
me,
shaped.
I am a manual therapist. I work with my hands all day, and I'm kind of, I'm bent over like in these positions. And so I specialize in headaches and jaw pain, actually. So I'm always kind of bent over people's heads. And in between every patient, as I walk from one patient to the next, I'm stretching myself. And that's because I don't want to get locked up into this one position all day. And my shoulder starts to, I start to get a little impingement, little rotator cuff issues if I don't correct my posture. So as I'm walking from room to room, I'm already stretching. I'm going like this. I take a moment at the doorway to stretch. I'm trying to open myself up here. And so everybody's used to it, but that's how I maintain my health, with the repetitive work that I do. And it really goes same for your workouts, for your swimming or your weightlifting. It is repetitive work. Like if you're cycling a lot, it's repetitive. You're staying in a position for a prolonged period of time. So you want to get up and you want to, counter it with the mobility. so that you don't have issues with your neck, especially. And you could have, I mean, this is right now we're having an epidemic with this pandemic and working from home, an epidemic of tennis elbows, neck disc issues, and lumbar lower back disc issues. And it's all from sitting and repetitive static positioning. So I want to help everybody to get more upright and just move. If you can move a little bit, if you can walk outside a little bit, just take that moment to be up and stretch while you're hopefully, maybe you're in a meeting or something, but you can just kind of move around a little. That would serve you well in the future, so you don't get locked up into these postures and then have to spend money coming to see people like me to correct it. I hope that was helpful. So I would welcome any other questions or specific issues that you may have. And Rachel, would this be a good time to mention the AlterG a little bit?
Yeah, definitely.
Yeah, I just want to, I mean, since I have this camera up and there's no one here, no patients, I can walk around and show you a little bit. But we have, so you may or may not be interested. We have a anti-gravity treadmill that is used for rehab. And for some people, especially our distance runners, if they have some injuries, foot injuries, hip, knee, back, that's preventing them from reaching their goal, like running, let's say a triathlon or even a 5K. If they're having injuries while they're running outside, they can also run on an anti-gravity treadmill with less than their body weight. So it is neat because we're the only ones in this neighborhood that have it. You do have to get into special shorts to get in it, but we can program how much weight to take off your feet. Let's say you want to run at 80% of your body weight. That's your sweet spot, and we can do that. If it's 50%, we can do that. So it's kind of neat. It is here for the community to use, to rent if you need it. There is advantages to running in the water. There's also advantages to using a device like this. That's the anti-gravity treadmill right there. So the advantage of using this is that you don't have to get wet. It's very quick in and out. And we bring this carriage down and you get zipped into the machine. And we bring it back up at your hip height, and the air compressor will blow up the bubble and it'll lift you up to whatever setting we have it at. And so frequently, patients will find that they have pain when they're running running outside. If they take maybe 10% off, then they have less pain. So then you know that if you take 10% off your body weight, then you'll be much better off and have less injuries on your joints. So that's just something that we have here for the community to use. But also running in the water is great because you get the resistance of the water and you also get the buoyancy. So this one, you get the buoyancy. You can also, because you don't have the resistance of the water, you can go at your same speed that you would outside. So again, there's advantages to both. It's a really neat machine because NASA designed it for their astronauts for the anti-gravity environment, and the rehab implications were so great that they released it to the private sector. And so now some of us in the community, we can have a machine like this and help out patients who had musculoskeletal injuries or neurological injuries. I can get stroke patients in there because I don't have to worry about them falling off or tripping. And also I've had some kids in there that are tall enough to use the machine. Does anybody have any questions about the AlterG treadmill? No?
I would like to see you hop in it.
I'm sorry.
I would like to see you do it. Get in those special pants and jog away.
It's I mean, I could. I'm not prepared for it because I'm not wearing the right kind of shoes. But
Oh,
I mean, if anybody wants to try, they're welcome to come and try it. It would be at no cost.
that's really cool.
Yeah, and if you know anybody that's, especially like middle-aged runners with injuries, they really love it. So if you know any middle-aged athletes that are having issues, like they can't get to race day because they keep hurting themselves, and this is something that they could try out. Yeah, we love it, and we use it for almost everybody that we can, for different issues. Lots of high school athletes here, even like, just if you're 70 years old with an ankle issue, so we can treat a vast array of ages and issues.
Right. I know we have a lot of members that really only stick to the pool workouts just because they are really nervous about, doing any kind of impact, whether it be through cardio, strength training, whatever it is. So I think that would be a really nice stepping stone for them to see how they can move, just taking a small percentage off. It might encourage them to then ease into other exercise.
Yeah, and it's not so much as a, advertisement for me. Like I've had it for, almost 10 years. But really, I mean, it's just another tool. So if, again, I think running in the pool is great. But if you wanted to work on the speed part of it, then the pool would be difficult. And so there's definite advantages to using the AlterG. And also we've had clients who rent it for 3 hours straight. So they're like Ironman, and they're pretty much running almost their full distance on the AlterG at, like, for example, 80% of their body weight, and they can still do the distance training without the injuries. There'll be a little bit difference in a metabolic burn. So you have less of a metabolic burn when you're on the AlterG because you weigh less. But the advantage is that you still get your heart rate up, and you can go the distance and get your body ready for that distance on race day without being injured on race day. So I think it's a good service, good thing to have in the community. And I wish more people knew about it, because it's really a neat and very very good machine. Yeah.
And I would agree that running in the water is a great option, but your gait is totally different. If you want to work on gait training with less impact, that treadmill is an excellent way to do that. Whereas the pool, you're not going to be you won't have the same gait.
Absolutely, because you can go through your normal gait motion, and so and we have cameras, and so you can actually watch what your feet are doing, and by going through the same gait, instead of like just your toe off, like in the water situation, it more replicates what you would do outside. So there is an advantage to that. But all of you are welcome to try. But also, if you know any injured athletes, please spread the word that we have an amazing anti-gravity treadmill here. Yeah.
Absolutely, that it's amazing.
Yeah. So do you have any other specific questions for me regarding injuries or post-workout recovery for certain activities? I hope you all stay healthy and maybe, I think there's a lot of information out there now that you can really treat yourself. And a lot of our patients, have a lot of tools themselves, especially the roller type of things, to improve their muscle health. And so there's a lot of videos out there. We use some kinesio tape, not too much, but we're treating things after the fact, after things already happened. So hopefully you guys can all stay healthy, and you want to avoid working through pain. And if you have little aches and pains and inflammation, then you make sure you talk to Rachel or Kendall. You're good sources right there. And you can also, contact me. I'll be happy to help you, in whatever way I can. But the goal is to stay healthy, and from a muscle recovery and joint recovery point of view, just make sure your feet are well supported. You have good arch support. You have the best shoes that you can afford. You can afford, and the running shops are really great. They can do all your foot analysis. The foot support is really one of the best things you can do, because you're putting impact through your joints. If you don't invest in good shoes, then you're going to end up in here as a patient with foot, knee, hip, and spine issues. So I would encourage you to change your shoes often, and make sure you have good investment in your shoes. But as a PT, I treat injuries through the manual therapy, soft tissue techniques with my hands, with the tools as I showed you. It's a lot of joint mobilization, joint manipulation, some dry needling. I do a ton of dry needling for my sports and pain patients. And it's posture correction and teaching patients the right way to move so that you don't injure yourself again, and just retraining your brain to move in the correct way. So, but I guess I hope this talk was a bit helpful for you. I guess this is my first time leading a Zoom session. It's a little bit awkward for me, but thank you for joining.
Thank you so much.
Yeah, and hopefully next time we can do this more in person.
Yeah, that would probably be the easiest for me to do in person. I would love to have like a breakout session here or at the at the aquatic center, and just get my hands on people and really show everybody as a PT like how to move and how to lift, and how to work on your injuries. That would be the best way.
Yeah, that would be awesome.
Yeah. But congratulations for making it this far. And I can stay if anybody has specific questions.
I think you answered mine, but thank you so much for your time.
Oh yeah, you're welcome. My pleasure.
If we want to schedule a time on the treadmill, do we just make a phone call?
Yes, you can call us, because we need to make sure it's at a time when there's no patients on it. So I mean, it's used a couple of times a day, not throughout the whole day. So and then also after hours we can do so. But yeah, you guys can just call and then ask for a trial. We have shorts here, so you can use them.
Okay, great.
And we will be sure to include the contact information for Tang in our weekly bulletin, just so everyone knows.
Okay. That sounds good. Thank you so much. Thank you for having me.
Thank you.
Thank you. Have a good night.
All right. Thank you so much.